So the other night about 2 a.m., I woke up. It felt like there was a fish flipping around in my chest. That's not the first time that's happened. And given what I do, I had some suspicion that maybe I have atrial fib. I've got some significant risk factors. First of all, genetics. I have 4q25. My mom had atrial fib, and I suspect I got that from her, or the 4q25 gene. That's a risk gene on the q25 area of the 4th chromosome. Now, I'd been checking my, I got this about a year ago, and have checked it a couple of times. This is called cardia. And as you can see, you put your fingers on here. It's an EKG rhythm strip that you can do right there on your iPhone. So I'll tell you a little bit more about that episode and what I'm going to have to do. But first, a brief introduction. It's Ford Brewer, F-O-R-D, B-R-E-W-E-R, heart attack, stroke, cancer, disability prevention, Prevmed. I'm the medical director and chief physician for Prevmed. And today we're talking about atrial fib, part 2, my own personal story. So just briefly, what is this cardia device? It's a device where you can check your own episodes to see if you have atrial fib. Now you look at that and you see the EKG on the iPhone. And you say, well, you know, you're a doc. You can read that. I can't. Well, they actually have a mechanism where you can just press a button and get a professional read on your rhythm strip. So if you ever wake up every 3 or 4 months, like I did, with a feeling of like a fish jumping in your chest, or if you just have that feeling, you may want to invest in one of these things. It's 99 bucks. Now, so here's what happened. It was 2 in the morning last Sunday, and I woke up. I had several things indicating that it probably was, in addition to those symptoms, that fluttering in my chest. And by the way, you don't have to have fluttering in your chest to have these. A large portion of people have no symptoms at all. But anyway, I got my iPhone and my cardio electrodes, and I looked at it. I got it set up, and then I did an EKG, and sure enough, my rate was in the 150s. So that's consistent with atrial fib. I could not find a P wave. That's okay, don't worry about it if you don't know what that is. That's just part of the EKG, and it's the part where the atria contract. So that was another clue that maybe this was atrial fib. Another clue was the software itself said possible atrial fib. That's always a good clue. Here's another thing. This is the rate. The interval between these beats shows the rate. And as you can see here, between these 2 beats, there was a significant difference. So you get what's called an irregularly irregular heart rate. You know, boom, 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 boom. And that's what you feel. That's classic, the irregularly irregular heart rate with a ventricular response, you know, significantly over 100. That's a very classic atrial fib thing. I did it again to make sure. Saw the same things. And I did it again a few more times. This time the ventricular response had gone down to 142, but I still had it. I woke up the next morning, checked it again. The rate was down to 107 at that point, but I still had some atrial fib. Again, you can see some of these classic areas where you get major, you know, really close complexes followed by really far apart. You also get something that's interesting. you get this weird wide-looking complex. That indicates what we call Behrendt Conduction. We'll talk a little bit later about how that works. Basically, the atria are the pacer for the heart. And that's why you get, if you get the chaos that you get with atrial fib, then you get, that's why you get this irregular heart rate. You get a boom and then a boom, boom. It's just whenever you're getting these, let me just show you something here. So if the atria are the pacers for the heart, and they're going in a circular motion, then you're getting too rapid and random hits on the AV node, the atrioventricular node. Those random and rapid hits result basically in a pacer for the ventricles, which causes that irregular response. And so in the morning, something had calmed down my AV node, and I was down to a rate of 100, even though I was still in atrial fib. Just to, I didn't think to do that then, but I did just recently for this video. I went ahead and did a repeat to demonstrate that, yes, I'm out of atrial fib right now. The rate's a little bit high because I worked out hard yesterday, and that's a good thing. I did interval training and high-intensity interval training and resistance training. And the HIT, if you look at a couple of videos I just did recently on atrial fib and exercise, high-intensity interval training is a good thing to do. And there's even a case to be made, even if you're having an episode, probably safe and healthy to go ahead and continue your workout. Anyway, I won't get into that debate right now. This is about the episode that I had. So here you see the rhythm is normal. Boom, 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 boom. The normal rates in between. Like I said, I usually have a rate down in the 60s. I'm standing and I've been doing some workouts, so I'm closer to the mid-70s right now. The other thing is, each one of these complexes, it's hard to see it on this, and it's actually hard to see it on the readout that I have. But each one of these complexes has a P complex, meaning you can see the organized impact of my atria. Now, why is atrial fib important? We'll talk about that in a minute. Why do I have atrial fib? Well, I mentioned it already. Genetics. I've got 4q25, which I got from my mom. Here's some other risk factors. Sleep. I've tended to have problems with sleep my whole life. Actually, with increased resistance training, I have recently begun to sleep better than I have my entire adult life. And again, I credit most of it to increased resistance training. Alcohol. 3 or 4 times a week I'll have a drink or two. I think overall over the week I probably have maybe 6 to 8 drinks. That's the upper limit of normal and maybe a little bit high, even for a male, for atrial fib and stroke risk. So I'm skirting the edge of risks there, but so far I had found that to be worthwhile. Exercise, now here, not too little, not too much. That really doesn't fit me. The reason I put not too little, not too much is that's a classic thing. It's called the J curve for atrial fib. A little bit of exercise is seen to decrease atrial fib. However, for endurance athletes, you get a significant increase, 2 to 7 times increase for endurance athletes. I've run half a dozen marathons, I don't know how many half marathons, and I even did an ultra marathon, 40-miler, although I did really badly. But I've I've got a bunch of risk factors. I'm not surprised. And again, I'd been tracking my my own episodes to see if I had atrial fib, and sure enough, I think I do. I'm going to need to get this worked up. I may end up going on something like Xarelto. Now, what is Xarelto, and why would you go on that? I'll go through a thing called CHAD2-VASc2. It's a decision-making process on whether or not I need to take a blood thinner. The blood thinner is to decrease stroke. Atrial fib is a major risk factor for stroke. There's debate over the mechanism. Some people think that it's just a fact that atrial fib is associated with obesity and high blood pressure and diabetes. Well, I've got a little bit of high blood pressure, but it's totally controlled. I've got a little bit of insulin resistance. I'm totally controlling that as well. Again, I've got 4Q25. I'm 60 years old, and I've been an endurance athlete for most of my adult life. 15% of strokes are due to atrial fibrillation. So someone that has strokes or has atrial fib needs to be looking at what we call CHAD2-VASc2 to help us make a decision on whether or not you need Xarelto, Eliquis, or one of the other new anti-clotting drugs. This is from the Xarelto website. It makes a point about what's the advantage of these newer anticoagulants, what we call them the NOACs, new oral anticoagulants, over what we used to have. Obviously, we've had aspirin, then we've had Coumadin. Now we've got, again, the NOACs. With Xarelto, no regular blood studies to have to monitor it. With, again, no known dietary restrictions. You obviously can't eat things that have vitamin K for the vitamin K antagonist Coumadin. And you really don't have a lot of frequent dosage adjustments, again, like you have with the other things. So again, I've got some significant risk factors. I'm still a little bit young. You get an increase in risk factor if you're 65 or older. You do get some increase on CHAD2-VASc2 for stroke if you have atrial fib, for alcohol. So I'm going to need to do some thinking about that. And I will keep you posted on my progress. Thank you.